Now, I'm just put on the recording because we did promise a few people who couldn't make it that we would record it. And we will probably get some people walking in as we go. I've had 56 register, so I'm guessing that there will be a few walking in, but we'll also have those who are watching by recording. So welcome. For those who don't know me, I'm Gina Ingrell from Effective Policy, and I've got Alison Webb, who also works for Effective Policy. She's a technical genius on the LMS. So clearly we wouldn't be here without her because she knows so much about it. Now, is there anyone here, does everyone know where the reactions are? If you look on your ribbon down the bottom, you've got something called reactions. So you can put your hand up, you can put a message in the chat box if you have something that you need to ask, etc. The reactions have, you've got a hand up, you can clap me or Ali at any time you like. You can put your hand up or wave, whichever, raise hand. Or if you want to say yes or no to something without putting your mic on and off, you can put a thumbs up, which is a yes if I ask a question. So today is all about, well, I'm all about compliance and quality in health and human services. So, and you know, for the last few years, I have been focusing very much on the NDIS scheme. That has not always been my focus. I've come from health and community services standards, and I do the retirement villages standards, and I do white ribbon, which is the domestic violence standards. They're voluntary standards. And I do quite a bit of work in the home care and aged care sector as well. But the focus is on NDIS at the moment because such an influx of people into the market these days. So once upon a time, before the NDIS, in each state, we probably had about 200 providers in each state. And if you add up the states, that's, you know, just over 1,000 providers in Australia. Now we have something in the vicinity of 27,000 providers. So that is an enormous amount of providers and an enormous range of backgrounds and expertise and skills that these people come from, all of you. And so there is a big, there is room for knowledge building. And so I'm always trying to come up with some better way to manage your obligations, so that it's, having been a manager and a CEO of a not-for-profit a couple of times and a service manager, was always about that inner lazy person in me wanted to be able to do as little work and have as big an impact as possible. So always about finding systems that are going to make it easier, not harder. And so when I see people doing things the hard way or the long way or not at all, you know, there are better systems and processes that you can engage with and improve as you go along. So today is going to focus on what our learning management system can actually give you, and how many standards it can actually tick off, but not just about that, how much easier it can make your life. So when I took on the learning management system a few years ago to roll out to clients, it was about seeing, as an auditor in the NDIS, for the NDIS Commission, it was about me seeing that, gee, 90% of the people that I was auditing had no clue whether they were owner, manager, no clue about what those policies said. They didn't know what the standards said. They didn't know what policies and procedures they were supposed to be following, and therefore most of their staff didn't know either. So in fact, we had almost, you know, very low literacy on how to manage the service they were running, and what the standards were asking of them. So that's why I developed the learning management system. Initially, I turned all of those policies into learning modules. And in so doing, not only did they mean that you could be assured, have some assurance for yourself that if you put people through, newcomers on, you know, and even your existing staff through those modules, that they would have some idea of what their job was supposed to be, and that you could say effectively that your staff know what the, you know, they had exposure to the quality and safety standards, especially the ones that are mandated to be to to be spread across all staff. So that was the reason for it. And then it's gone on a little bit further from that, and it now has, other training as well. And webinars where whatever webinars I do, I also put them up there so that other people can watch them. So it's got quite big. And so we found a lot in this learning management system that we think can really, really, really assist. And there are some people here or perhaps watching my recording later who are already my clients in terms of they have what is called a branch on my LMS. There are two ways you can use this branch, this system. You can either just use it casually, which is you just buy the courses for your staff when you want them, and anyone with a volume amount of staff gets big discounts. Also, I have about 16 people or so organizations that have their own branch. So it's like they have their own LMS because they have a piece of mine, a piece of the pie, if you like. And so for them, we'll be touching on some finer points as well. But let's begin. And Ali has the PowerPoint up for me, and I'm going to speak to it. So what are your obligations and what can this LMS help with? Number one, your workforce training, their capability and their capacity to do the job trained for. Putting it really simply, when I got very acquainted with the NDIS quality and safety standards as an auditor, and I was looking for evidence for certain things, I could just see how there could be some easy ways to do this, and so making sure that there's training available in complaints, incidents, infection control, emergency and disaster management, mealtime management, and the quality, safety and use. Now, quality, safety and use is available on the Commission site. It is their course. But what I do is I put a gateway in mind so that you don't have to send, I get to see a lot of confused staff. They've got to go there, then they've got to go here, and they've got to go everywhere. So I just tend to just bring that one in to my LMS so that they just have a gateway to it, and everything is in one place. You can have a seamless way of accessing courses. Whether you took a branch with LMS, with Effective, or you didn't take a branch, you can still integrate that this LMS training program into your website by simply putting a code in your in your web page. Very much like Ali, if you'd just like to show how I integrated into mine. So I have a learning library, and it matters for this reason that, staff lose the URL, staff will have breakdowns in their browsers, and even if they did have it saved, it's gone again and you're forever having to send the URL. So what we did was we just embedded it in our site as well, and that's what most of our customers do. You've got sharing there, Ali, have you?
Yes.
So here, this is how I've just, you can embed it into your site by either making it a page or making it a link that they click on, just to make it easier. You could also just have it routinely in your own signature as well. So just to make it easy, because every barrier to people getting trained or accessing something is another reason why they won't do it. So just to make that simple. So going back to our PowerPoint, so that's how it is. We help people to embed it in their sites, and it looks like yours. So it's just like you just have a page name that would say, whatever, ABC NDIS Training Center. And so we've got some really mandated things, which I've just read out to you. Then we need some assurance that clients have, then we go further than that. We go to that participant particularities, the things that they have. And we always knew from the beginning that this was going to be something that was tailored to every participant. So we don't need to train everybody in diabetes. We don't need to train everybody in epilepsy. But when you have a client on board that has a particular complex issue or health issue or diagnosis, then you're obliged to actually ensure that your staff of work that are working with that person have the proper awareness in the actual diagnosis or the condition that the person has, such as assurance that when clients have diabetes, epilepsy, behaviour support, anaphylaxis, autism, cardiovascular disease, mobility issues, they're at risk of fall, complex health issues. As you might have seen, there are practice alerts that are coming out or come out. I think they'll continue to come out as new things are seen as problems. And the reason that they will have been tailored, why they've chosen those practice alerts, is because incidents will have shown that there's been hurt to either staff or to clients. So that's how they collect that incident data, and it's really easy to see as a national body then what are some of these issues. And in that report that came out in December, which showed that the quality of life of participants is always reduced for people who have a disability, but over the period of time of the NDIS and how long it's been in, that there had been unnecessary deaths, very early, deaths where people should have lived longer. People weren't living their life to its fullest, and that there were a lot of uncomfortabilities and poor quality of life for people. So hence the practice alert, and hence whenever, which has been really, really good for me, is that when I've seen things in the auditing landscape, and as a consultant to other clients as well, I've noticed these things, and then I've noticed practice standards come out. So I feel like that's quite good consolidation, that what I'm seeing is not just that I'm seeing a small amount, I'm seeing a representative picture of what is really happening. So that's good. So then you've got your team your leaders in your organization. Many of them, and I'm going to go out of the, I'm just going to say a nominal percentage. I don't have the exact percentage, but it feels like about 90% of the team leaders, owners, operators, and managers that I interact with, whether it be through audit or whether it be through consulting, don't have the necessary skills in governance. In fact, many people don't even know what governance is. And it's no surprise that when we see all sorts of things happening and problems, it really speaks to there being a governance problem in place, and also a knowledge base around compliance and quality. So they're big. I mean, they're not only are they the biggest detractors from having a good service, but if they're that big in a detractor, then having some knowledge in those areas can really make a difference. So it's obviously it's a liability if you don't have the knowledge, but it's an enormous asset when you do, because good business is not a secret. There's no secret about how to run a good business, and certainly no secret in how to run a good health or human service business. It is governance, quality, and compliance, and responsiveness, which fits in under there in the governance. So we have some learnings for leaders as well. So then the other thing that we'll be able to show you, which is a new part to this, which we've been talking about, Ali and I, for a long time, but is putting your own no, that's not the new part. Hang on. Putting your own in-house policies. So, okay, so you've got all the policies that you're mandated to have, but you're going to have some extra ones. Some people do. There are people who have will have a policy around, for example, I've seen people will have a shift handover policy. There's nothing in the standards that say you have to have that, but someone's noticed that, wow, we have a real mess when there's a shift changing. So they write themselves a shift handover process, and they can put that on the LMS, and just like one of the other courses, have people go through that and make a little assessment. So taking a branch on this allows you to be able to do that. It allows you to be able to write some courses, put some handouts up there. You've got PowerPoints that you saw somewhere and you've got permission to use them. You can put them up as well. So not only do you get our intellectual property, you can make your own little courses as well. One of those areas is often work health safety, which is important and very, very individual to every organisation. So, and it's important to have your staff look at a work health safety document and sign that they've read it and understood it, because as a manager, as a person that runs a business, if you can't show that when it comes, if someone gets hurt, then an insurance company is there to look for any excuse to get out of paying. And if they won't pay out, then somebody can actually pursue the business themselves to pay for when they've been hurt or injured in the workplace. So all of these things are all compliance obligations, but some of them are there to protect the owner as well as the client. The other thing, which is the new part that we are going to talk about today, is how you can actually store files up here yourself that have nothing to do with these training courses if you have a branch here. And what we've seen, another part of what I see is and I've just come back. I think I look over the last 2 months, I've done 5 audits, and in 4 of those audits, I think I found organisations that hadn't done any assessments on their clients. They hadn't done any support plans on their clients. They hadn't certainly done any risk assessments, and not having any risk assessments, there was clearly no risk management strategies. It all came down to they just don't know. Number one, they hadn't read the policy. So we need to make sure that people know what the policy says about assessment and support plans. And then they didn't understand or know or were able to find what forms were supposed to go with that. So we've actually going to show you later how we've been able to upload policies and tag some, connect some forms to it. And, what I really want to do is increase people's ability to take up the right documents, to take up policies and procedures, and make it easy for them, and make it easier for managers, because I'm on the manager side. I'm on the participant side, believe me, that's, human rights, but I'm on the manager's side because I've been there and done that, and I just want things to be easy, streamlined and systemized, so that they're ready for audit. I also see a lot of people suffering when they're about to get ready for audit, and they ask, they'll ask us to come and do an internal audit, and they are nowhere near. I mean, I think almost every client we've had to say you'll need an extension before your commission audit. And I see a lot of suffering. I see people's health will diminish in the getting ready stage. It doesn't have to be like that. If you plan it right, and if you do the quality and compliance as you go, it doesn't get to that sickening part at the end where you're not ready and you're just so stressed. It really, it shortens your life. It affects your health, just like we were seeing client health affected. It shortens your life. I remember my very first quality safety standards for drug and alcohol in 2002, and I was very, very sick after it, having to bring together a very rogue organisation to get ready for that. This stuff can make you really sick. It doesn't have to happen. Let's do it a bit at a time and take all the systems that we can to make it easy and make it be happening and a part of your culture. Next slide, Ali. We'll get into the groovy stuff in a minute. So this means that we're just going to give you a brief overview. And in fact, I can't see any one of my existing clients in here. So they're probably going to get it by recording. So that means we can actually show you how this works. And we were going to kind of keep that brief. So let's show you, how we really cater to people being able to manage their compliance obligations on here. So what happens is that we've got courses, we've got users. We add a user, we add several users. We can make up packages for people which apply to their, we have a mandatory package, which is, 17 particular modules, which I wouldn't want, which include those ones that I read out to you, which are mandated by the standards. But then other ones, which I just wouldn't want anyone starting work in my operation until they knew. I would want them to have the code of conduct. I would want them to be introduced to what is a support worker. I would want them to have professional boundaries training. There's a few other things in there that I personally mandate as well for a better, smoother operation. Remember, many of our support workers don't have any experience. And even if they do, it doesn't mean they got the right training wherever they came from. And so we can make up packages which suit, ABC, NDIS. This is what your cohort of clients looks like. So here's a sort of selection of courses that we'll put in your onboarding package, and we can put it aside for you. You don't have to have a slice of our LMS to do that. You can just be, a casual user. We can put a package aside for you, and every time you onboard a client, we can give them that. You can even add your own personal stuff to that should you wish to by just sending it to us, which might be about what happens, might be that shift handover. It might be, what happens in the SIL house when you're having a shift handover. It could be any of those. And so, Ali, I'll just let you show people through. So this is what it looks like. Now, if you're only using casually, you won't see this. This is what we do when we're onboarding people. But if you wanted and are thinking about a long-term training option where you have the keys to the vehicle and you don't have to ask anyone to do anything for you because you've got access to everything. So let's show people what we would do, Ali.
Yeah, so when you also take up a group of courses for yourself, we do send you a custom report each week as well, just to let you know, but it's not as in-depth as these ones, but just because we want you to see how many courses the people that you've onboarded have actually completed.
That's
but
right.
You won't be able to download their certificates yourself. So, for example, reports can be about the users, about the courses, or even about the entire group of courses, which will give you all the information you need in one go. So
and what I should just say there, because you're right, and I forgot to say it, is the biggest thing is, what's the evidence that your people have completed these? The reports you get. The reports that you get from us that say your staff have completed this, and this. That's your evidence. You don't even need to keep a training register if you have that evidence. Continue, sorry.
Yeah, that's right.
I'll do that a little bit.
So if you'd like to download a report, say, of a specific user, you can go into reports, user reports, and just export it to yourself. It'll give you everything you need to know. You can see when they've logged in. You can even see a timeline of what they've been doing on the LMS. You can see any certificates. This was just an example. So this person doesn't have any certificates on their profile so far. This is just for the showcase. But that's how you would look at user reports. But if you, say, wanted to know, how is the course that I've made about your policy going? How is my support planning documents going? Click on that one and you can export it in Excel as well. And you can also schedule these to come to you weekly. If you'd rather not have to go in manually, it will just come to your inbox once a week. You can check how it's going. Perfect.
Yeah, because what you find is you get people who struggle. You'll get people who'll go on straight away and do what you've asked them to do. And then, of course, you're going to get people who won't. And that's the report is brilliant for that weekly, because you can get on top of people straight away. And you'll also see who took a really long time and struggled. You'll also be able to see how many attempts they needed to do it. And that is good information to have, because if someone is struggling with one area, that's good. If they're struggling with many areas, you need to know that.
Yeah, so that's just how you do a course report, and a group report is the same again. Just click on group report. We don't have any groups in this demo branch, just because.
So what a group is, you can have two types of groups. One is a group of courses, for example, the mandatory module set for onboarding people. That's a group. We set it up as a group of courses. But then our organizations who have branches with us, they have groups. So they've got their admin staff, that's a group. They've got their clinical staff, that's a group. They might have their managers, that's a group. So groups can be people, or they can be courses.
Yeah. So just quickly made a little group. So just click on that and you can see how many people as well, how many are active in the group and how many have never even logged in. How many?
And that's always telling, isn't it? That's just lovely to see. We'll see when we see someone's never even logged in.
You can see the graph as well, logins, how many people have logged in, how many courses they've completed. Obviously, there'll be more information when it's your own branch, but for an example one, doesn't have quite as many. And the timeline is really good as well. You can see that I've just created it a few minutes ago. And that's just a really good way to make sure that you can keep up to date. Oh, I thought there was a course in there. It seems it wasn't added. You can check when they were added. You can check if someone's deleted a course from a group that you weren't expecting.
One of your admins, if you're a large organization or even a medium size, we find most people have a few admins, a few people that are able to drive the LMS. And so you can just keep a check on what's going on.
And for the reports, you can also get them in infographic form if that is more your style, if you'd like to see it in a bit more of a picture way, and that can be exported to you as well. And also a training matrix, which will show you all the courses, and you can highlight people to see not started, not started.
Some people like that. And the other way, of course, is in the Excel spreadsheet, which is, you know, we like. And most people find that quite easy to read.
So that's all about reports.
So we've touched on, you can have groups of people, you can have groups of courses, you can have users, obviously you add a user, and then the last thing was adding the course, and then having your reports on the course or the users, the whole thing, and that you can schedule them so they come to you every week. Now, everyone gets a certificate. If they pass the assessment questions, they can download their certificate straight away, or they can come back and download them anytime. We recommend that for not having all that, like the certificates are kind of made for the learner. We don't mind if, of course, there's no problem if employers want to download the certificates. There's just going to be more storage for you when you've actually got the Excel spreadsheet, which is perfect. So usually the certificate is a sense of achievement for the person that's doing it. You can, when you have a branch, you can, if you put courses up, you get the same option. Do you want this course to be repeated annually, or is this a forever thing? Or do you want it to have a certificate? And you can select all those same things that we can select. And the actual system has an in-app help menu, which Ali will show you in a moment, which is really good. So what's next?
Yeah. So sorry, did you want to see the help menu?
Yeah, have a look at the help menu. So when you want to say, I can't remember how to download a certificate.
Yeah, you just click on the help and it'll give you either introductory videos, or there's a whole knowledge base which has all of the articles you'd ever need to know.
Yeah. And we're always here too. So we don't say you're all alone, but if you were doing it at 11 o'clock at night and you really wanted to crack on with it, you could use the knowledge base. But we're pretty helpful.
Yes. Continue on.
Okay, so this is let's show people a couple of our courses. Maybe if you and then we'll sorry. Let's just go in and show a couple of courses, and then I'll get you to show them how you create one. So let's have a look at that.
So these are just a few of the courses we've got in there right now. So
can you make that zoom in, Ali? Because I know my eyes aren't good, but I'm struggling to see it. Maybe the whole page. Yeah, that's better for the oldies.
Sorry, large screen. So these are two of our practice alerts that we've just made. Which ones, sorry, do you want to go through?
Oh, go to pain management, that will be fine. So we build our courses in something called Articulate, but this actual LMS allows you to build in the actual app itself. You don't need to have Articulate as a branch person to do that, but that's how we build ours. But we'll show you how you can build yours if you wanted to. So this is one that we've already made. It's up there. It's doing its thing, getting used, learning, teaching people what they need to learn. It is one of the biggest things, and one of the biggest things with pain management is also around behaviour, because what happens is that obviously our least trained and knowledgeable people are doing work with the most vulnerable and often challenging people. And so we run into, there's a bit of a clash there, isn't there? So when we see a lot of behaviour, and I have a very, very good friend who's a behaviour support practitioner, friend and colleague, and as she says, when she goes in and helps people with behaviour, often it's pain. It's pain that's causing some of the problems. So not understanding the pain that a person can be in could be the very, you're missing the actual thing that can assist. Why is that person hitting out? Why are they, behaving in the way they are? Do they have a toothache? Is something hurting? Is their leg? Is there, pain is one of the biggest reasons, and also one of the biggest reasons that medication can be given. So there's a couple of important things about that. So hence why that's created. And so that's what one of our intellectual properties look like. They're good. And if people don't pass them, they have to do them again. And it's good information for you to know who gets it first time and who takes repetitive attempts to do it. I like to know that. That's something I flag if I want to know about my staff. And so you want to add a course. Example course. So this is how simple you can actually add a course to your own library.
So you can add an intro video as well for these courses. Say you just want a quick, just rather than typing it all in the description, if you'd like, if you've already got a video about the code of conduct for your organization, you can just pop that up there and then they can see, oh, this is what that course is going to be about.
That's
okay.
my intro. That's right. Or most of ours, we have a description in there, which is the intro to the course. Says, well, this course will take 15 minutes and it's about X, Y, Z. So you can do that by video or you can do that by description. You can upload your YouTube video, your Vimeo video, anything that you have on one of those cloud-based programs, you can upload. You can also just make your own. So some people make their own. Welcome to, XYZ NDIS. It's really good to have you here. A few things you want to know about our service, our vision. This is our mission. This is what we would expect from you. All of that. You can upload that, and there is your welcome already there. People can be onboarded before they start, after they start, during their first week, etc. So it can automate things so that it takes time. It takes that time is given back to you, and also you'll have evidence that it's been done and some assurity that someone has actually been. Look, we know people are going to read things and sometimes they're not. We've done our best to corral them so that there's going to be things they're going to get wrong if they haven't read, and that's why they'll have to repeat it. But they're usually on the very important things that you shouldn't be support working if you don't know the answer to some things. So you can put your own things up here, put a certification on them, put a time option on them. Is it something you want done annually? Is it something that you just want? Yeah, once is enough. It's a forever thing. And then Ali is a whiz at making courses on this, and she's an absolute whiz on making things on Articulate, which is the fancy one we showed you before. And we're very happy to take a certain amount of, if you want things written on your behalf, we can do that for you. But it's easy enough to just write them yourself up here. You can upload a PowerPoint. You can upload a Word document. You can just put the content straight in. You can do any of those things. And so this is not just about the learning. You can do this with your onboarding things as well. So it doesn't have to be a training course. It can be, what is it that you give people when they're coming on board to your business. And we hope that it's going to be a position description at some time, because most of the problems that I find when I'm out consulting, where there's performance problems with people, is my first question is, can I see the position description? And often the answer to that is they don't have one. So this is, one of those helpful ways to make sure that everybody has copies of these things as well. So you can write the course with or without a survey or a test. You can put an assignment. For example, we were doing assignments where we got people to take their washing their hands when COVID was when it first started, and we wrote the infection control course. We had an assignment, people had to video themselves washing their hands, and we marked them on that. If you have any other things that you really want to see people do, whether it's to do with assist with medication, whether it's to do with some of the module 1, wound care or catheter care things, if you want to keep your training ongoing for those, there are lots of things that you can ask assignments for. You can also do your own instructor-led training right here and call a meeting of all your staff together. This integrates with Zoom, Teams, and GoTo. And I have mine linked up to Zoom because that's my favorite. And you can have everyone on here. You can record it as you go or not. And you can just upload a presentation and do it from here as well. And then you just add it as a course so that the next time you need to run it, it's there, ready for you. What else? So example courses. I think that sort of covers that. If I missed anything there about people adding their own.
No, I think that's it. And then I'll
Okay.
go on to the next one.
So now here's really something that's really exciting in terms of compliance and quality. As I said, what's the biggest issue I find as an auditor? That, like I said so many times, there's no assessment, there's no risk assessment, and sometimes there's no support plan. How can we make it easier for people? What can we do? Well, what we've done here is we've uploaded for example, support planning policy and procedure. Now that's great. So that's up there, and anyone can access that on their smartphone, on their iPad, on their laptop, on their desktop, any device at all, they can refer to that. But I think we kind of have learned that there's a very small percentage of people that are going to read their policies. So there are some, but there's a very small percentage. So what I've done here is I thought, because I just came back from Far North Queensland where I did some training with an organisation, and what I did was say, all right, here are the forms that need to be used when you're onboarding somebody and going to develop a support plan. So what I've done here is go, okay, here's your support plan policy and procedure. That's great to know, but what I think they need to know is which forms connect to it, and that will make it a little bit easier. So we've connected, firstly, the consent form, because people forget to get consent in the first place. I'm not talking about consent from the NDIA. I'm not talking about that at all. I'm talking about consent to do anything and collect their information, which I find is probably one of the biggest standards that's not done, or if it's done very partially. So, so I've connected consent to that policy. I've connected the assessment to that policy. Now the assessment, they said, oh, but I know a lot of that stuff. It doesn't matter what you know. What's in your head is absolutely irrelevant. If you've got no evidence that you've done this, then you're going to get a major non-conformity. And frankly, if you think that it's okay to just have it in your head, that's a thought that needs to be rethought, because it's not. This is a paid service. Someone is paying you to manage a support plan for them, and you needed to collect some information. But come down to the standards. How can you prove to me that you've collected enough information that you can say, under Division 1 of the Quality and Safety Standards, this is person-centered because I collected lots of information. I've gone through all their privacy and confidentiality obligations. I know whether they give consent to the auditor to audit their file when the auditor comes. I know who I can speak to in their family and who I can't. I know whether I'm allowed to take a picture and use it on my social media. I'm going to guess there's probably about 70% of the pictures I see out there on Facebook, I'll bet you that people haven't even asked permission, because that's what I see as an auditor. That's what I see. So having all these things together helps to make a system where it can't be so easily forgotten. Then we assess. So we have consent, we assess, then we risk assess. There may be no risk. It's very unlikely. There may be no risk, but wherever there is a risk, you then need to go and make a risk plan. And that has been very much underdone in the sector so far. So how can I help people to remember? By tagging those to a policy, so that people will start to get to know, well, number one, the forms are here, so I don't have to go looking and I don't have to wonder. I actually really feel for people. It's like, how do you get a form? I think I know where they are, but I'm not sure. That was a team leader. And I thought, got to get easier than that. We've got to make it easier than that people have things at their fingertips. So get consent, do a thorough assessment, do a risk assessment. If there's a couple of risks there, you need to do a rating and a risk management plan. And there's plenty of webinars on my site about doing just that, going through the whole process. And then you need to write this this dastardly support plan, which is basically the set of goals that this person has and how you're going to achieve them. It really is like the cornerstone of the entire scheme. And so when it's left out, I am a little bemused. I'm a little, I'm confused and I'm baffled. But if I could go in and make an impact and get people to start doing this, that's the important part. Because I think that in many ways, it's not all the providers' fault that they're not doing these. I think that the Commission has to take responsibility for allowing it to happen in the first place. So that's why I'm very happy to help people to upskill and get to know these things. Because what I love is when I look through Facebook and I see all of the innovative services out there, I know a lot of them probably aren't doing assessments and risk assessments, and I'll freak out and fall over backwards if I went there. But I do love to see the innovation that we did not have. And Janice Dennehy, who is here in the meeting today, we worked together at Aging, Disability and Home Care in policy for quite a while together. And now she's become one of my auditors, and she'll attest it was pretty boring back in the day. A bit of bowling, a little bit of basket weaving. There wasn't a lot going on, and now the sky is the absolute limit with what people can do with their money, and these sensory rooms popping up everywhere. And once again, there's probably no risk assessment, but putting that aside, I'll get to them eventually, or one of my colleagues will. But seeing just how much goes on, the fact that people can have a holiday, I just think it's amazing. I mean, I think it's brilliant. So we've just got some stuff to fix, but I think it's better than what we had in many ways. So this is one of my ways of, helping people to be able to have somewhere to put their policies where their people are going to be able to access them, not be able to steal them, but be able to access them, be able to access the form right then and there and fill them out. What else? And that can be done on all of the policies of importance, And going back, Ali, and you can see over here the, we've shown the files already. You were already showing the files, weren't you?
Yeah, they're up here.
They're downloadable. Yeah.
Yes, those are downloadable. And to do that, you be in as an instructor. When you're building a course, you're automatically changed to an instructor. Then you just click on the Files tab and you can upload files. And if you decide I don't want to share that anymore, you just take it away, or you can add it back in.
Yeah.
And if for some reason the name's wrong or the naming convention's wrong, you can change it. You can also add tags. For example, if you decide you want to start a tag system on these policies
for them. Is that what that's for?
Yes.
Yeah.
Yes. So if you wanted to have this is just forms versus policies, you can search for them that way. It's quite a neat little system of how they've done it.
So we didn't know about that for the last few years of me having this system. We've just discovered that we can do that. So it was a learning management system, but now we've discovered it can be a document system as well. And the beauty of it is that we can tag those documents so that people will know what documents they have to use. And if they don't use them, that they are making a clear decision to not do their job, because they're there. They don't have to dig for them. They don't have to say, I think I know, but I don't know. They're there. That's what we want to do, is make it organized. So I think that's probably what excites me as well, is being able to do that. And going back to the slide again, Ali.
Yeah, one sec.
So that's just a how-to, because we'll send you the PowerPoint out as well. Because it's obviously there are some people who are coming in here who already have branches, and we were going to introduce them to some of the new stuff that we found, which is around this document management as well. So we'll send that off. What was our next port of call?
So you can also you can add files directly into users rather than in a library of sorts. So for example, if one user in particular needs just one form that you don't use often, it's no point being in the library, but they need it, you can go directly into them. I'll just show you how to do that. So you can click on a user, click on them, and there's a little files tab, and you can upload a file for them.
To that user profile. And so what I thought of this for me, what's the other most underdone thing is supervision and recording of supervision. It's underdone, which means, yeah, it's not done in a lot of cases for our support workers and our managers. But also, even when it is done, at times it's not evidenced. So we need to evidence it. It doesn't matter that you say you do it. If you can't show us that you do it, we're going to say it's not done, because anyone can say that they do it. So we have to have evidence of it. And so I guess there are lots of softwares out there that really help you manage the participants. There are some that you can collect the hours that a support worker or staff member does. Very few that help you to, except for HR ones, and that's a whole separate system. Very few that help you to at least manage some of the things around the staff and be able to perhaps keep some supervision notes in a really appropriate place. So what seems to me a really sensible idea is, if you've got all the staff that you have in this system, that you can keep supervision notes, and also it's the same place where training happens as well. So it just seems to synchronize really well. You've got all of your access. You don't even have to download it. You can give your auditor, you can guide your auditor. I wouldn't give it to your auditor. What I do is just guide them through it and say, this is the supervision for those staff. This is where we keep our notes. Supervision can be done in so many innovative ways, which is what I love about being an auditor. Is sometimes it's done face-to-face, piece of papers, coffee or over Zoom. But I've seen some organisations that are doing chat groups with certain groups. Might be all the house members in one house, or it might be all the support workers. They're using chat groups, and that is an excellent way to not only give that support, but also to record it. And that also helps for the support worker to refer back to it when they need to again. So I love that. Now this can do a discussion as well. So
yeah. Just one more thing to add is also you can make it so the user cannot view the file. So for example, if you have a few admins there and you need to keep notes on an employee, but you don't want the employee specifically seeing those notes,
like
you can make
supervision.
it.
Yeah.
Yes. So
yeah.
they won't be able to see it.
Yeah. So it does really have the discussion board. Let's have a look at the discussion board, which people can follow or not follow. And this is where I'm thinking, like, support and supervision is really, apart from keeping the notes there and being able to allocate training to people straight away that you've had that discussion with. Say everyone's confused, well, because most people are, around restrictive practice. So you could start a discussion on restrictive practice. This is a way for upskilling. It's a way for supervision to occur as well. It's a way to really get people engaged and learning more. You can pop documents up there. For example, we popped one up there, which is the ABC behaviour chart. And I mean, you don't have to be registered for 2A to be using an ABC, behaviour chart. By the way, 2A is for the implementation of restrictive practice. You do not have to be registered for that group to be using an ABC behaviour chart. If everybody in a SIL house was using ABC behaviour charts for everyone, we'd have a whole lot less incidents occurring and a whole lot less workforce stress. And Matt might take this time to remind you that now the legislation is absolutely making organisations take responsibility where workers have an injury which has resulted in a psychosocial disability. So I would take this opportunity to say, now more than ever, supervision needs to be introduced. If you haven't started, you need to start. You need to start filling the gaps. You need to find out what people don't know. You need to put a focus on the challenging behaviours of our clients and what you're going to do to make a safe workplace for your staff and for your clients. So we need to start focusing on that now. And another thing would be, I would hope that one day, like physical first aid, I would hope that very soon that mental health first aid becomes mandatory as well, because I think there is far more mental health damage done than there ever is physical first aid needs. And an effective policy is a mental health first aid accredited instructing agency, so we can do that. And I would really, if you can't afford to have all your staff members attend mental health first aid, then at least have managers, unless they've got, in fact, I was going to say unless they've got mental health qualifications. But you know what? It's a little bit different to that. It's a concept all of its own. And what I find it does is not only assist with the people that you're working for and with your clients, it teaches the staff members about their own mental health, and it also helps them to work with their co-workers as well, because we see an enormous amount of mental health issues amongst our support workers. Remember, we are asking the most unqualified and inexperienced group of people to work with the hardest group of people that you would be lucky to get many psych nurses who wanted to. Even they would find it difficult. So we've got to remember the job that we're asking them to do. We've got to remember the lives that can be impacted by this, which is your client, but also your support worker. I don't know how I would lose count of how many support workers or peer support workers or etc. that have mental health issues from their work, because they haven't had the support that they've needed. They haven't had the training that they've needed. So let's deal with the reality. Our staff really don't have not everyone, I'm not making a broad swipe. There are some amazing people, but we have a lot of people who are new, a lot of people who probably aren't cut out for it, and we're going to have a lot of damage, and it isn't going to stop anytime soon. So let's not cost ourselves more down the track. Remember, you can go, I've got workers' comp. Well, don't forget, one workers' comp claim and you will be paying a much, much bigger premium, and you will be paying for those payments that are going out to that worker. So that's not the answer. Plus, your workers' comp will always be looking for an excuse not to pay, as well as your personal injury insurances, etc., and public liabilities. So we should just ask if there are any questions. And I should always ask Ali, have I covered everything?
There was just, I think, one more slide to go over, but that was just more of a wrapping up kind of slide.
Okay. So,
surveys.
Also, if you, I always come away saying often, there are some people who do their organisational surveys, which is, of participants, staff and stakeholders, but many don't even know they're supposed to do it. It is very clearly articulated in the governance standards that you need to have a good method to ensure that your participants have had a part in informing your policy and your vision and your strategy, etc. So one of the best ways to do that, in fact, it's just good governance, is to do a participant and staff survey. I would also say stakeholder. That's what we always did, when I say, before the NDIS, it's just what you do. You ask people how they find your service, what you can do better, what they like about it, what they don't like about it, what would you like to see changed. You can do surveys in here, and it keeps all the information in one lovely little place.
So just as an example of a survey for you. So, sorry, it's still on question 2. Just, you can do rating systems. You can have as well some feedback. So you could have a course
text.
We call it course just because that's what they call on the thing, but obviously it's not necessarily about learning, it's just a survey. But you can have one up there that's just any feedback that you want, all times, and then you can also have specific ones for specific surveys you're doing.
So nice to have them automated and be able to send them out. And where you can't, where you have a participant that obviously doesn't have an email, you will need to print them out perhaps, or have someone sit with them while they do it, or but most staff have email, so, and stakeholders have email. So
there were just a few questions in the chat.
Oh, that's the future systems, right? Okay.
Kejin said, can we restrict course to certain stuff only? Yes, you can. So the courses you make, you assign users to them. They don't automatically go for them. So you get to pick who goes in where. You can give people as many.
Yeah. In fact, they don't get access to everything. You have to give them access to things.
The only reason I can see all the courses right now is because I'm a administrator in this. So they wouldn't be able to see it. A learner, for example, they would see it in this view where they would have any courses that are assigned to them, and you can see how far along. I'm an instructor because, again, I'm an instructor in this, but they can just see how far they've come along. They can see that they've completed it and they've got their certificate.
And down here, great session, thank you. If you're a user that uses the platform as a one-off, how would it work in terms of creating the trainings, adding in the forms, etc.? Would this be a subscription model? How does it work practically in terms of accessing the services outlined? Okay, so if you are not going to be a branch owner, you won't be able to have access to all of those document things. Being a casual user, which is where we have many, where people just say onboarding such and such, can we have 5 whatevers, here's the names, here's the emails. Really the only thing that you can access is the courses. To use everything and have, self-admin, which will be all the documents and forms. I mean, Ali, I can't see, I can't really see another way for a casual user to do that, because you're not kind of, although you have an organization name attached to all the users, I suppose we could make a group. I don't know whether they could still use surveys.
It could be a different subscription model where you'd pay for a branch, but we wouldn't give all of the intellectual property, perhaps.
Yeah, we could do that. We could do that without the intellectual property. So you get a small fee for having the branch, and you still have a sort of pay-as-you-go kind of arrangement, but just wouldn't be all the intellectual branch. But you might just have your own onboarding stuff on there, which uses some of our stuff. But you know what? I'm sure we could figure out something. So do we need to manually add a course to the student, or is there an option for automatic all of that? Well, you know what? There's an automated way to have an organization can say, I want my organization to have this package as the automated one that is given to somebody when they log on. And that might be your onboarding one. So for every new person that comes on, the mandatory manuals are automatically given. Whichever ones you choose to be automatically given are given. So you can do that, if that answers your question. Apart from automating it for when someone logs in, etc., they get given XYZ. Then you go in and select. But I would encourage after that first onboarding that you would be choosing things based on a person's weaknesses and strengths, and on the participants that they're working with as well. That's the most important part. The participants they're working with, do they have anaphylaxis? Make sure they've done anaphylaxis training. If they've got diabetes, make sure they've done that training, because we don't, we see people going, let's go and have a Coke. Yeah, let's have lots of Coke. We need people to know that's why the practice alerts on lifestyle diseases has come out, because people don't know about diet. We've got to get people trained to understand these things. And quite frankly, I think a lot of people become empowered when they know something a little more than being a kind of companion for someone. They start to, you don't know who's going to come out of the woodwork in terms of be your shining, next champion until we give them the information to start with. Any more? So do we need to create SCORM course? Not in this course. So we create SCORM when we write, because we're writing in Articulate. You can write a course in here and it's not SCORM. If you want to do SCORM, you have a couple of options as a branch person. You can ask us to write it for you, and of course that would cost, or you can get a subscription to some sort of learning thingy, like Articulate, that you write it, but you don't need SCORM for this.
The course builder, it has all the features that Articulate and all those have. The Articulate is just a few more bells and whistles to make it like maybe look a little bit more shiny and polished, but the learning is still the same. The assessments, even, I find that sometimes the course builder has more options for in terms of assessments, whereas Articulate, it's mainly just a multiple choice. Is this one you can upload assignments? So if you wanted to, for example, make the course in a SCORM, you could do that and then create an assessment using this course builder. You can mix and match.
Yeah, and what was I going to say about Articulate? I don't really know because it's gone out of my head now. Sorry. Let me see. Have anyone got any more questions for us? Let me see. Feel free to turn your mic on if you've got something you want to talk, not write. I mean, for me, my fingers hurt when I write, so you are most welcome to turn on your microphone. Well, we'll send out the recording. We've also dropped in the message, and we'll send it out with it, the catalogue and a brochure, which really explains like the specifications of this wonderful brochure that the specifications of the course are, we've only touched on some of its integrations. You know, it really does have a lot going for it, this LMS. I don't know what I was going to say. We only started using Articulate 6 months ago, and for two and a half years, I wrote courses in here, and we never had a complaint from anybody. We just had nothing but praise actually for writing them. So, you know, we've progressed, but at the same time, nobody ever made a complaint about us using the files in here. All right, well, I think we're good to go. You guys know how to contact us if you need anything. If anyone wants a free trial of the branch, please let us know. Easy peasy to do that. So one new message. What about pricing? Okay, so it starts at, in terms of the LMS branch, it starts at 10 people for $250 a month plus GST. And then it goes 20 people for $350. And then after that, it's just $5 a user. And that's it, basically, unless you want us to commission us to write you a course. But that's it. It's really good value for money. What you'll get back on that, I think the return on investment will far outweigh, you know, the amount of hours that any of your staff who are onboarding may currently be using doing it manually. And if you're not doing it at all, well, you know, I say no more. You really need to make sure people learn this. And you know, what's the cost of compliance? Well, I think the more important question is what's the cost of non-compliance? It's a lot of stress. It's a lot of work. It's another audit on top of your audit. Like if you get more than a couple of non-conformances in one audit, you have to come back in 3 months for another. And you've just, you know, people pay thousands of dollars for me to fix do their remediations for them between those 2 dates. And so that's a big cost, big. So, any more questions?
Yep.
Well, it's been lovely. Oh, I can see a name or two in there that I've known over the last couple of years. That's so lovely. Okay, well, we'll let you go. You know how to contact us. Drop us a line whenever you like.
Thanks, Gina. Thanks, Alison.
Thanks for coming.
Bye.
Bye.